It's the peak of flu season, and Dr. Erwin Sanchez of Harlingen Pediatrics Associates says that this has been a particularly bad one. In recent weeks, he says there's been 30 to 40 children per day who have tested positive for the flu. And now the Centers for Disease Control are calling the flu an epidemic, with Texas having high rates of the virus.
Sometimes the vaccine doesn't get all of the strains that are going to come and affect us. And sometimes the strains mutate, so we don't protect everything and everybody.
Over the weekend, a 4-year-old child died in Port Isabel, reportedly from the flu, even after visiting 2 clinics for treatment. Dr. Sanchez says each year thousands of people across the country die from the flu due to related complications that further weaken their immune system.
Dehydration, pneumonia. There's something called ARDS, which is a respiratory syndrome that you can develop. It's like an immune reaction from your lungs that your lungs they stop working.
Dr. Eleanor Cajita says for the most part, patients are getting their shots, but still 9 out of 10 patients are testing positive this season.
In fact, we're getting patients where they're actually testing for 2 kinds of flu.
She says children in close proximity to other children, such as those in school or daycare, are particularly prone to catch the flu, since it can be airborne or transmitted through mucus and saliva.
Right after the holidays, we have a huge surge of patients coming in being tested.
Each year, there's a big push encouraging people to get vaccinated for the long flu season that runs from about October to sometimes May. Because even if getting the shot doesn't prevent the flu every time, it will at least make the symptoms that come with the virus less severe.
It protects you from getting really, really sick.
Having some protection is better than none, especially for young children and the elderly who may not have strong immune systems to beat the virus.
If you see somebody that's sick, don't be shaking hands, kissing, hugging.
And of course, getting the flu vaccine, number 1.